Randomized trial of peanut consumption in infants at risk for peanut allergy. Peanut allergy is a type of allergy different food allergy to nuts. It is a type of hypersensitivity reaction foodstuffs derived from peanuts causing an overreaction of immune system. It is recognized as one of the most severe allergic reactions food due to their prevalence, persistence, and severe allergic reaction. The physical symptoms of allergic reaction may include mild itching, hives, angioedema, rash, facial swelling, sneezing, rhinitis, asthma, abdominal pain, fall blood pressure, cardiac arrest, and asphyxia. A peanut allergy is one of the causes more common death from food-related anaphylaxis. It is estimated to affect between 0.4 and 0.6% of the population. In England, it is estimated that 4,000 people are diagnosed with peanut allergies every year, 11 per day. 25,700 have been peanut allergy diagnosed by a doctor at some point in their lives. Allergies to peanuts can cause severe anaphylaxis, an emergency that requires immediate attention and treatment with epinephrine. Symptoms. The symptoms of peanut allergy are related to the action of immunoglobulin, IgE, and other anaphylactogens, which act by releasing histamine and other mediator substances, mast cell. In addition to other effects, histamine induces vasodilatation of the arterioles and constriction of the bronchioles and the lungs, also known as bronchospasm, airway constriction. At least peanut allergens have been identified. Symptoms may include mild itching, hives, angioedema, swelling facial, rhinitis, vomiting, diarrhea, severe abdominal pain, rash, asthma, unemployment, and cardiac anaphylaxis. Diagnosis and treatment. Facial, rhinitis, vomiting, diarrhea, severe abdominal pain, rash, asthma, unemployment. The diagnosis of food allergies, including peanut allergies, starts with analysis of medical history and physical examination of patients. The guidelines National Institute of Allergy and Infectious Diseases recommend that parents and patients reporting some type of food allergy are examined by a doctor, since several studies show that 50% to 90% of the alleged you can use prick tests to confirm skin allergies to certain food. Tests of skin puncture are designed to identify a specific connection between IgE and mast cells cutaneous. During the test, a fat allergen extract and glycerin in drops placed on the skin of patients, one which is then punctured about where they were deposited the gotas. The rash that developed from the drop is obtained glycerin extract compared with the solution of test salina. Allergic consider positive when the wheel extract glycerin is 3 millimeters larger than the produced by solution salina. The positive skin test is about 50% accuracy. So a positive skin test alone is not diagnostic of food allergies.
all you need to know about peanut allergies. We know that everyone has food that they don't eat because they don't like, maybe broccoli or carrots. But did you know that there are some foods that kids don't eat because they actually can't? Have you ever wondered why some of your classmates aren't allowed to eat some of your favorite foods? If a certain food makes you sick every time you eat it, it means you have an allergy. Maybe you have a friend or a classmate who is allergic to peanuts. Your teacher probably told you that you can't bring a peanut butter sandwich for lunch because this classmate can't be around peanut butter. But why? Why can't you have peanuts in the same room as a person who's allergic to peanuts? Let's look at what happens when someone who is not allergic eats a handful of peanuts. This is your body's normal response to food. Food is a very good thing. It gives us energy to run, play, and think. Normally, a person's gut or intestine will break down foods like peanuts into a size tiny enough to be absorbed and later converted into energy for your body. When a person's intestine can digest peanuts normally, they are said to be tolerant of peanuts. But those who are allergic to peanuts are intolerant. Their bodies don't think that peanuts are normal and don't think that they can be a helpful form of energy for the body. Their intestine cannot break down peanuts into small enough pieces, so some peanut proteins make their way through the barrier of the gut and enter the person's blood. Your body is made up of millions of tiny units called cells. When your body detects these peanut proteins outside of the intestine, it triggers your immune cells to respond. Your immune system is basically your emergency response. When your body senses that something is wrong inside, it will call on your immune system to get rid of the problem. It is important to realize that just how people look different, all people have different immune systems, meaning that people's cells can react differently to foods. In this case, the immune system sees the peanut proteins as bad invaders who are not in their proper place. These invading peanut proteins are called antigens. Cells called B cells produce proteins called antibodies that are made to target a specific invader. Antibodies are shaped like a capital letter Y. The antibodies that are produced as a response to peanuts are called IgE. IgE antibodies are docked on the surface of cells called mast cells. When IgE runs into an invading peanut antigen protein, the ends of it attach, or bind, to specific sites on the peanut antigen. Once the IgEs are attached to the peanut antigen, the mast cell becomes activated. The mast cells contain hundreds of little signals called histamine, but the mast cells keep the histamine trapped inside until it meets an antigen. Then the mast cell releases its histamine signals. Think of histamine as the 911 call to the rest of the body. It tells your body that it has been invaded by something that shouldn't be inside it. These histamine signals scatter through the rest of the body and cause it to react in lots of different ways. First, the lungs will constrict, meaning they get smaller. The person's throat also tightens, so they will have a hard time breathing. The histamine also makes your blood vessels get wider, making your blood pressure go down. This makes your heart work harder to pump more blood. These effects are called an allergic reaction and are extremely dangerous for anyone with a peanut allergy. In the most serious case, the person can go into shock. This is why you can't bring a peanut butter sandwich to school, because the peanuts will cause anyone who is allergic to have an allergic reaction. The person with an allergy doesn't even have to eat peanuts. For some people, they will get an allergic reaction from being in the same room as peanuts, so you have to be extra careful, especially at school. But you can never be too careful. Anyone who is allergic to peanuts carries a device called an EpiPen for emergencies. The EpiPen comes to the rescue whenever someone has an allergic reaction. An EpiPen contains a drug called epinephrine. This drug is injected into the person's leg so it can get into the blood. Epinephrine basically reverses what happens during an allergic reaction. It causes the muscles in your lungs and throat to relax, and it makes your blood vessels squeeze back to their normal size. I bet you never noticed that anyone carried an EpiPen, right? So how else can you tell if one of your friends is allergic to peanuts? Some kids wear a bracelet to show that they have an allergy. But most of the time, there is no way to tell if someone has an allergy. That's why it's super important to be careful of what kind of food you bring into the classroom or cafeteria. And remember, it's not just peanuts that kids can be allergic to. A person can be allergic to all kinds of foods, or even things that aren't food. As you can see, there are lots of things that someone could be allergic to, and you would not even know it until they started having a reaction. Humans all have the same organs on the inside, but the cells that make up people's organs don't always act the same in everyone. Some people's cells decide that certain foods are bad, and they attack these foods when the person eats them. According to the Center for Disease Control and Prevention, an estimated 6% of children under the age of 18 have a food allergy. We humans have a lot in common, but we can't all eat the same common foods. Here are some peanut safety tips that you should keep in mind at school. Number 1, it is important to check the ingredients of the foods you bring to school in case they contain a hidden nut ingredient. Number 2, don't share your food with classmates, especially if they have a food allergy. Number 3, make sure to wash your hands after eating anything with nuts. We can all do our part to make sure that everyone in our class stays healthy.
Kids' Allergies, Peanuts and Tree Nuts. Disclaimer: the materials and other information provided by this presentation are for educational, communication, and information purposes only.
Tree nuts, like these, grow on trees. Here's what some types of tree nuts look like inside and outside their shells. You must not smell, touch, taste, or eat peanuts and tree nuts if you're allergic to them. Peanuts and tree nuts hide in foods like these and many others, so be careful. When kids or adults offer you foods you're not sure are safe, politely say, "No, thank you." To find out if food contains peanuts or tree nuts, ask,
Will you read the ingredients for me? Does it contain peanuts or tree nuts? Was it made in a facility that processes peanuts or tree nuts? Was it made on equipment that processes peanuts or tree nuts? Has it ever come into contact with peanuts or tree nuts? Are you sure?
always use clean utensils and don't share with anyone. Exposure to peanuts or tree nuts could make you feel
Scared, sick, faint, itchy, dizzy, swollen, nauseated, breathless, or other symptoms.